Good afternoon, everyone, and thank you for joining us for this media briefing. My name is Lisa Lord. We will be addressed by Prime Minister, the Honorable Mia Amor Mottley. Also present are the Honorable Dale Marshall, the Attorney General and Minister of Legal Affairs, as well as the Minister of Health and Wellness, Lieutenant Colonel Jeffrey Bostick. We will begin with Minister Bostick, who will give an update on the current COVID-19 situation.
Thank you very much. Good evening, everyone. I am indeed happy to report that our stats continue to trend downwards as they have been for the past few weeks, and this is indeed a good sign. We would have recorded 7 new positive cases out of 453 tests that were done overnight at the Best Dos Santos Public Health Laboratory. Out of those 7 new cases are all female, and we also continue with our community program, our random testing program, which we've been doing over several communities over the past several days, and this is continuing. What the figures clearly indicate is that the positivity rate is trending in the direction that we want it to trend, definitely below 5 for at least the last 4 weeks or so, and within the last several days it has been trending at 2%, and in some cases we've even been below 2%. So we're doing quite well in that regard. But the situation is that we still have cases, and we still want to get that rate a bit lower, but we're going in the right direction, which suggests that we're all doing what we're supposed to be doing. And I am asking Barbadians just to continue in this vein, because if you continue like this and we continue to do well, then we'll be able to do more for the country. Thank you.
Thank you, Minister Bostick. We now move to Prime Minister Mottley.
Thank you very much, Lisa. It is a pleasure to be here this afternoon again to address you Barbadians. As you heard from the Minister of Health, our numbers continue to drop, and we are happy. Last time I spoke to you, we had a situation where our cases per 100,000 were at 66, and the 2 weeks before that it was at 110. It is now at 40, but we are not yet where we want it to go. We want it below 25, and really we want it at 0, but we understand that we live in a world where we don't have the luxury of controlling that, and that globally there is still great uncertainty with respect to this awful pandemic. We have, however, been conscious that Barbadians have largely responded to the protocols, have largely been cooperative, and even though we have a situation, as I said, that is still uncertain globally, we do believe that we have to continue to live. As I said earlier, I think it was a few weeks ago in Parliament when I addressed you, the one thing we can't do is to stay still. And I learned many years ago, paralysis is literally the worst thing for any living organism. As a result of us therefore recognizing and being very happy that Barbadians have largely risen to the occasion to fight back this pandemic, we believe that the time has come for us to take certain other changes and adjustments so that persons can indeed be more comfortable in terms of not only where they work, but also in terms of the other things that they need to do to sustain themselves, both body and soul. As a result, the Cabinet and others and the Cabinet Subcommittee have gone through multiple types of consultations with the EOC, with members of the Barbados Association of Medical Practitioners, with the University of the West Indies, with the Social Partnership with respect to the arrangements for tourism, which I will come to shortly. But we felt that it was critical to start to look to see how best Barbados can come back to some level of normalcy with respect to how we function. When last we spoke, I promised you then that we would look at certain things once the positivity rate remained largely below 5%. Indeed, it has been largely below 2% for most of the last 2 weeks. I think there was one day, Jeffrey, where it went over 5%, But other than that, it has been 2% and trending to 1%, and a few days actually below 1%. It is against this background that we believe we can press the accelerator a little bit. And I've always promised you that we will shut down sharp, we will open back up gradually. Over the course of the last month, we have been opening back up gradually. We've come now to some of the last things we believe that still remain before us. Gyms have been kept closed for some time now. We have allowed exercise outdoors. The public health officials and others are of the belief that we can reopen gyms, but strict protocols must remain in place. These new directives will take effect from the 11th of April to the 26th of April, and as I said, we will continue to review. I should tell you that in addition to gyms, we are also now taking the decision for beaches and parks to be open from 5 in the morning to 7 p.m. There are to be no picnics or parties, and we're asking people just still to come out gradually, take your chance, take your time, and you can stay on the beaches, you can have their fun, but we're trying still to avoid situations of large gatherings and people mixing in a way that could cause the gains of the last 3 months to be compromised. Small pleasure craft, therefore, will also be allowed to operate at 50% of the capacity, but there will be no return at this point in time to the larger party boats, party cruises, as I think they're called, AG. And Minister Humphrey would have met with the boating community to resolve these issues. Water sports operators will be allowed to participate, and I want to say a special thank you to them, because even when we met 2 weeks ago at the Lloyd Erskine Sandiford Center, as we reviewed in one of the many meetings to review the tourism protocols, they quite understood why we couldn't move at that stage, and that they therefore have been very patient, and I thank them for their patience. But as I said, wherever possible, we would get to you, and we are ready, and we believe that we can start back with your operating your trade. Generally speaking, we have taken a decision that there will be no curfew on Monday, Tuesdays, and Wednesdays, and that we will limit the curfew now from 11 p.m. at night to 5 a.m. in the morning for Thursday, Friday, Saturday, and Sunday. The Chief Medical Officer is firm in his view that there must continue to be an attempt to keep numbers reduced as we move about the country, because we are not out of the woods. As a result, he has asked that we still keep retail and supermarkets closed on Sundays, but with restaurants operated, being allowed to operate. Bars will be allowed to open back, but they will operate at a cap of 50% of capacity, and equally no parties in bars. Cinemas, theaters, nightclubs, and discotheques will remain closed. And of course, we are not allowing karaoke or bus crawls or excursions at this stage. Fast food restaurants will be permitted to have patrons in the restaurant, but as we all know, physical distancing, mask wearing, hand sanitizing, and the recording of the data on the patrons entering the establishment must be adhered to, as well as all other relevant protocols. We are removing the restriction or the cap of 75 persons for church services, but we are still requiring the social distance of 6 feet, largely because it is critical that we ensure that persons remain safe as they praise their Lord. Mask wearing will continue at all times, as happens everywhere else, and the churches were already doing an excellent job, in fact, in recording and adhering to the protocols before. We recognize that if we adhere to the ratio of the 6 foot distancing, that we will be in a position to have in larger churches more than the 75 persons, and therefore they should be allowed so to do. With respect to funeral services, a maximum of 100 persons may now attend funeral services where the protocols permit. If the church in which the service is being held obviously can't hold 100 persons, then you can't have 100 persons. But if it can, then that is the number to which we can go. And Minister Walcott has been very clear on making strong representation on behalf of the religious community with respect to this as a result of his conversations. A maximum of 100 persons also may attend wedding ceremonies where the protocols equally once again permit. There can be no partying, but we will permit wedding dinners or lunches, in other words, meals to celebrate the fact that the persons have come together in marriage, and we will hope that that will suffice, and we ask you to leave the dancing and the partying for another time, because we all know that we want to make sure that everybody who has come to your wedding will be there to see you on your first and second and third anniversary. So to that extent, we ask you please to cooperate with respect to that. In the next 2 weeks, we will start discussions with the Barbados Turf Club, with the Barbados Olympic Association and the National Sports Council and all of the other sporting organizations to see how we can return to a level of normalcy for contact sports. It may well be that we start with a framework that allows training and games, but without spectators at this point in time. But honestly, there's just simply not enough days or hours for us to have done all that we've done while still having the requisite consultations with the sporting organizations. And we therefore hope that the Ministry of Health, Jeffrey, will start, not hope, we know that the Ministry of Health will start those conversations with them at the beginning of next week. So my friends, and if you recall, on an earlier occasion, we had already approved the non-contact sports with the exception of table tennis and squash. And at this point in time, they will be held back until the conclusion of the discussions with those bodies that operate and control those sports as well. My friends, as I said, we live in uncertain times, and if you doubted it, a week ago when I was talking to you, we did not know that Soufriere in St. Vincent would be literally under and creating real pressure and at risk of erupting and leading therefore to the evacuation of thousands of persons in St. Vincent and the Grenadines. I've spoken to Prime Minister Gonzalez already. He knows the support of Barbados and the Barbadian people, and our prayers are there with them. But I want to say that that uncertainty also meant that the same cruise ships that we had in our waters, off our shores for the last few months, when I spoke to Michael Bailey at Royal Caribbean, and the Minister of Tourism has been speaking to officers of Carnival Cruise Corporation as well, we were very happy that they immediately responded to Prime Minister Gonzalez's request, and therefore I think that the public is already aware that the first ship should arrive in the waters of St. Vincent and the Grenadines tonight, with more coming tomorrow. These uncertain times require sometimes difficult decisions, require challenging conversations. And over the course of the last 3 months, we as a people have had those difficult decisions to make and those challenging conversations. But our experience over the last 3 months have shown as well that we can come through it. And if we stay the course, believe you me, we will continue to come through it. It is against this background that we recognize that that thing that sustains us and sustains the majority of economic activity, or a large part I should say, because it's about 45% indirectly of economic activity in this country, cannot remain shut down and closed, particularly given that since the beginning of this year, there has been a large number of persons in our traditional source markets who have been vaccinated and who have expressed a demand, a determination that they would wish to travel going forward later into this year. We also recognize that there has been an increase in savings in a lot of households in those markets, even though there has also been high unemployment in certain sections. Barbados, as you know, last year, I've spoken to you over and over about it, we lost $2 billion in economic activity. And as a result, we also saw our unemployment rate go sky high, and we saw our revenue as government drop seriously low, and we saw our expenditure increase in order to meet the demands of fighting the pandemic. We also have had to put in place myriad arrangements to support households and the business sector, and are continuing to do that even as we speak. And ironically, in the discussions that we have been having in the World Bank and IMF meetings this week, there has been a clear recognition that the pandemic can become a corporate pandemic if we're not careful and if we don't put the appropriate systems in place to support economic activity. And that the consequences of that corporate pandemic can be as devilish and as difficult in many instances as that of the health pandemic. It is against that background, therefore, that the government undertook a set of clear steps to determine how best we could safely reintroduce the larger numbers of visitors coming to our island. We started with the process of the Cabinet Subcommittee chaired by Minister Walcott meeting with the EOC and meeting with the Barbados Association of Medical Practitioners. They then went, after that meeting, to include in the second meeting the Barbados Tourism Marketing Inc. and the University of the West Indies, who were able to put clarity on the projections and the numbers and what we can control and contain and manage and what we can't. Thirdly, we then went to include discussions. After them, all of those parties would have met with owners of hotels, hotel workers, representatives of tour attractions, representatives of the taxi operators, representatives of the water sports community, representatives of the unions, a wide cross-section of persons directly engaged in the tourism sector. The fourth such meeting was with the Social Partnership last Wednesday, when we would have met and they signed off on the recommendations that had come through that three-stage process. And the final stage would have been Cabinet signing off on what was agreed to as amended by the various parties. As a result, I'm in a position to announce today that we do have a settled protocol for vaccinated persons, and a vaccinated person is defined as that person who in a two-dose regime has received both doses plus 14 days, or a one-dose regime, one dose plus 14 days. And as a result, they would now be permitted to come into Barbados with a different set of protocols from those persons who are unvaccinated. In essence, and the protocols will be released to the public, but in essence, it still requires that even though you're vaccinated, that you come to the island with a PCR test that is negative from within the last 72 hours, and that upon arrival in the country on the morning after, that you will do a PCR test, whether a rapid test or a classic PCR test, and that you will have limited movement within the hotel if you're staying in a hotel, in a government facility if you're staying in a government facility, but that we will continue to review these protocols to ensure that they're functioning well. Remember, these are vaccinated persons. Remember that the chances of being infected again, having received a vaccination, is still potentially there, but the chances, they believe, are minuscule. And to that extent, we have tried to develop protocols that meet the risk that the country will face from those persons who are vaccinated. We ourselves have reached a stage where we have over 64,000 people vaccinated, and we will continue to vaccinate persons. As you know, we received additional vaccinations this week, but because we knew those were coming, we had started the process, and therefore what we received this week will lead to somewhere just under 10,000 persons being vaccinated again with both doses. And why? Because the government is committed to ensuring that those who have already received their vaccinations get their second dose. And we have those on hand and are in a position to start that. I believe that on the 4:30 news, I heard Dr. Ferdinand indicating that we will be reaching out to those Barbadians who started the process in February and will be required to come for their second shot. I think most people already have a date that was given to them on the card that they received when they went for their vaccination. Bottom line is that we don't therefore start from this as we were a year ago. We have the additional protection of vaccinations on our end, and we have the protection of the vaccinations on the end of the person who is coming. We equally know that these protocols will continue to change, especially when we reach herd immunity. But at this point in time, we are being very cautious and ensuring that there is still a safe environment. Those persons, once they receive a negative test result from the test that is then applied in Barbados, will be free then to move about as a vaccinated person within the community, as a visitor or a national returning, if that is the case. Those protocols will be circulated. As I said, I'm happy that we went through that it was a difficult process, but we did it assiduously. And in doing that, we also ensured that we gave an opportunity to the widest cross-section of civil society to also be invited to the social partnership. So the Barbados Christian Council, the Barbados Evangelical Association, indeed the leader of the Democratic Labour Party was also present. All of us were present, and we went through it. I was very careful, to the chagrin of many, to go through it sentence by sentence and clause by clause, because there is many a slip between cup and lip. And therefore, given the fact that so many Barbadians depend on the ability to earn by us having additional people visitors, and let's put this in context. We have just under 300,000 people living here, but tourism has brought on average 60,000 people per month. Those 60,000 people per month are just long stay visitors. With respect to the cruise industry, they are about, you can average 8 months a year, when they will bring about 100,000 people each of those 8 months of the year. So by the time you add roughly 700,000 plus 800,000, you are almost 5 times the population of Barbados at some point in time being on this country. Now, what does that mean? They eat, they drink, they take transport, they go to attractions, they do all kinds of things that add to spending within this economy. If those persons are not coming to Barbados, what then happens? That all of a sudden there is a massive reduction in the amount of goods and services that we sell, in the amount of rides that a taxi man can get, in the amount of goods a vendor on the beach can sell, in the amount of food a restaurant or cook shop can sell. All of these things immediately are contracted. Now, by the same token, we all know that we need, whether we recognize it or not, we take risk in life every day. But in taking risk, we try to be safe. And the country, therefore, must be no different with respect to ensuring that safety remains our primary concern, even as we open back up to the world. We feel, therefore, that it was important for us to establish a tripartite monitoring committee, which over the course of the next 4 weeks will work with the hotel sector, with the tourism attractions, with the stakeholders like the taxi drivers and all others, to make water sports operators, beach vendors, etc., to make sure that our protocols are as tight as they can be, and to make sure that the framework for monitoring is also as tight as they need to be, recognizing that even though the risk is minuscule, that we are not and should not be allowed to drop our guard. The University of the West Indies, in their plotting of the data for us, have literally shown us that in the event that there are issues, we are making sure that what we're doing is containable and sustainable. And to that extent, therefore, I'm comfortable with what has been placed before the Cabinet and what, therefore, we have finally agreed to with respect to that 5-stage process. I should say to you that only today the draft documents with respect to the cruise industry have also been finished, but I'm not going to address them this evening, largely because I believe that we need time to just sign off fully on the details. But what we had done before, and in principle, as you know, I co-chair the America's Cruise Task Force, and in principle, we have agreed that we would want the home porting to start back by the end of June. With respect to the protocols for the long stay tourists that we just talked about, new protocols for the vaccinated long stay tourists, those come into effect from the 8th of May, Saturday the 8th of May, and that's why I said we have a month to have that tripartite monitoring committee tighten the things and ensure that Barbados is truly ready for us to be able to welcome people properly back to the country in larger numbers than we have seen, obviously, in the last few months. We will stand ready, however, to continue to tweak and respond to the protocols, recognizing that the two guiding principles of safety and competitiveness are the two that are critical for us to review as we look at what has to happen in the system. My friends, this has not been an easy decision. It's not. And as I keep saying to you, this is uncharted territory. We have now gone through 2 waves of COVID. And we've regrettably lost persons, and we've regrettably had persons who also economically have also lost their livelihoods or are at risk of losing them. This is the most difficult time in the world's history for 100 years. This morning, yet again in IMF World Bank meetings, very early this morning at 6 o'clock, we reflected on the fact that we are likely still to be in the long haul because of the difficulties related to access to vaccines globally. And even though, knockwood, Barbados has done reasonably well in being able to have just about 30% of our adult population receive a single dose already, we are conscious that there are many who have not. And therefore, there is really truth in the simple statement that until everyone has access to vaccines, everyone elsewhere is at risk. And that is largely because of the variants and the mutations that take place. So that while we are opening up gradually, as I said, to be able to accommodate the other things that we must attend to, just as we can't ignore the fact that there are other health issues in the country, just as we can't ignore that there are other challenging issues that we face, like the climate crisis, or as we have seen in St. Vincent and the Grenadines today, the awful spectacle of a potential volcanic explosion, then we know that we have to take our time and to be able to literally recognize that this uncertainty means that that gas and brake approach that I've spoken of from the beginning has to continue to be our guide. We know that we have to continue to fight for comprehensive access to vaccines for countries, not just in this region, but literally, we have also to be able to ensure that we work together to give where we have excess. And if we reach a position where we have excess, then we have to do our duty too, subject to assigning or ensuring that others can take over aspects of our order if it is available. It is against that background that I've joined others in the region on calling not just only for access to vaccines, but we really globally have to look at expanded production capacity, and that's what's going to hurt us. Similarly, we have to be conscious of the variants, and to that extent, we are investing in the lab, as I've indicated before. Our reason why we are comfortable with giving the opportunities for vaccinated travelers and the testing is that, as I've said, we have 7 PCR machines in the Besto Santos lab. We have 5 automatic extractors, and we've asked them to order 2 more. We have the lab that is likely to be established at one of the hotels, and we have another lab that is likely to be established at one of our medical facilities. We also have in our possession 104,000 rapid PCR tests, and therefore we feel that we are comfortable and ready to be able to handle what we need to handle. Might I remind you that had we not taken the decisions last February with respect to the construction of Harrison's Point, we would be in a difficult position today, given all that has transpired over the course of the last few months. And the wisdom of that decision, quite frankly, is one of the strengths of our management of this entire process. I ask you to recognize that this process is going to require the cooperation of all Barbadians. We can do this together, and we can get back to a situation where our farmers can sell more of what they're producing because there are more people on island needing to eat. We can get back to a situation where our taxi men can start to move around again and be able to earn such that they can pay their bills and take care of their families with dignity. Similarly with our water sports operators and our beach vendors. Similarly with our hotels. And one of the reasons why we launched the BEST program, which is based on the principle of quasi-equity and equity. In other words, investing in our hotels to ensure that they do not fall under if they are willing to cooperate and to work with us, such that they can keep employment levels up, and equally that they can keep the hotel, literally, they can keep the hotel back in a state where it is not going to become dilapidated, and they will not have to spend extraordinary sums of money before they can receive visitors in it again. This is a complex process. We've never had a situation where all of our hotels literally had to be shut because of an absence of persons coming. We've been lucky that some of them have been able to get some business. Regrettably, it is as a result of quarantine and isolation, but they have been able to get some business going forward. And therefore, when I say to you that this requires all of our support, Barbados is one of the most hospitable places I know in the world. One of the reasons why we have one of the highest repeat visitor rates is because people like how Bajans generally have been able to make them feel welcome in their own land. And I trust and pray that we will continue to exhibit those aspects of hospitality that have given us that reputation for being hospitable to those who visit us. I'm being told, just as I am getting ready to finish, that there is a mandatory evacuation order now in place in St. Vincent, and that has been given by the Searchlight newspaper of St. Vincent and the Grenadines. And I repeat yet again that our prayers and our support are with the people and government of St. Vincent and the Grenadines. They are our brothers and sisters. Indeed, many of you who live here are related to persons there, and therefore we hope and pray that there is no loss of life and that the loss of property is minimalist. What I will say, I was a child when Soufriere last erupted, and I will never forget sitting down for lunch outside and having glasses outside on the table before liquid was put in, and the ash that came into that glass went right up to the top of that glass. There are some of us too young to remember the potential fallout of a volcanic eruption in St. Vincent, not just on the people of St. Vincent and the Grenadines, but on our own people here. There are other aspects of cooperation that we'll put in place, and SEDIMA and RSS, as you know, are already in pole position to assist the people there. We are supportive of both efforts, but separately the government and people of Barbados will do what we have to do. And I'll ask the people of Barbados to recognize, and this is a straight talk, when we came to you earlier this year, or last year rather, and spoke to you about how we needed to treat with compassion persons, and particularly those who were on the cruise ships as workers who could not get back to their homes because nobody was letting them through their countries, we Bajans took a decision to facilitate, and over 21,000 people were able to go back to their families as a result of that decision. It is that kind of decision that has laid the kind of framework for us to have the kind of humanitarian cooperation and easy access that we have today now, that allows those same ships and persons to be able to come to the rescue of our brothers and sisters in the road. And this is a lesson for our younger people in particular, that in life, the greatest gift, believe you me, is generosity of spirit. I have never seen generosity of spirit repaid with ingratitude. It may be initially the extent to which somebody may want to play that ball at you, but if you let it wait long enough, believe you me, you will get your just reward as a result of being decent and adhering to the values that we know make all the difference in the world in which we live. At this point, therefore, my friends, I'm sure that you will say that I wore this scarf today because I was coming with a little brighter news than usual. And if you say so, it is true. And I felt I had a little pep in my step, therefore, because it has been the most difficult thing to come here and to be able to hold a country together with the kinds of constraints and curfews and all of the other things that have made life difficult over the last 3 months. Jeffrey Bostic can tell you that. It's not easy. But we are satisfied that it has worked. And therefore, when there are still one or two more things that remain outside of your reach, or if there is still a limited curfew for now, or if we have to come back and restrict movement on a bank holiday, please understand that this is not because we want to punish anybody or to hurt anybody, but we know that there is merit and that there is a reward to be had by us being able to reduce our level of mixing, our level of movement, to ensure that we adhere to the protocols, the very basic protocols of mask wearing, hand washing, sanitizing, and then, of course, the physical distance protocols. We know that there is a benefit to vaccinations. And while we have not made vaccinating anybody mandatory in this country, believe you me, the world has seen almost 100 million people across countries vaccinated for the year so far, and we have seen where those persons have been vaccinated, the benefits for the most part of the vaccination. There have been one or two issues raised internationally, and we are aware of them. But when you look at the cost-benefit analysis, when you look at the risk and the benefits that you get, there is no doubt in our mind that we need to ensure comprehensive access to vaccines. And that is why this government has determined that we will continue to work to ensure that Barbadians and persons living here have access to vaccines on demand, and ultimately we will have to do so with any boosters going forward. What is our reality? We don't know. But it does not look as though the world can distribute vaccines in sufficient time in 2021 to everyone. And in fact, there are some who project that on present trajectory, we cannot do it before 2023. There is, however, the recognition that if the world comes together in a form of unusual global cooperation, that it can come together and ensure that we can shave off at least a year on that outer limit. And why? Because we do not need to see more variants and more mutations of this virus, because we do not know, they may be less virile or they could be complex and far more deadly, and we are not prepared to take those chances. In the meantime, however, we have a duty to do everything that we can to make sure that as many Barbadians who need to work can work, that the construction industry is firing on all cylinders again, that we can have manufacturing operate in a way that it has been operating before, and that we can make sure that the other aspects of business activity in our country can proceed, but that we start to create sufficient demand again, that new jobs can be created and more people employed and more people therefore in a position to support their families. My friends, with those words, I therefore say to all Barbadians, thank you, thank you, thank you for allowing us to reach this stage. But do not please let us drop our guard, either us who are here or those who come to visit us, because we recognize that, like elsewhere, if it happens, we will take steps to contain and to remove the risk again. And we are in a world where this uncertainty is likely to continue, as I've said, for at least another year. But at this point, we believe that the kind of behavior and the kind of adherence of protocols that we've seen, that we can all take a chance on each other. You take a chance on us, we taking a chance on you. And if we do that together, then I truly believe that we will see victory at the other end. Or as Jeffrey would say, that we will have exhibited no surrender and no retreat. At this point, we'll just take a few questions, because I do have another engagement this evening.
Yes, turning to the media, joining us are Ian Bourne from the Baden Reporter, Barry Allen, The Nation newspaper, Ryan Boom from CBC, Randy Bennett, Barbados Today, and Akil Lovell from Starcom Network. Now, gentlemen, given the unfolding situation in St. Vincent and the Grenadines, and as the Prime Minister just indicated, meetings are still ongoing, we will ask you to keep your questions to two at most this evening. Your questions?
My first question is a two-pronged one. Can you tell us if the government of Barbados has at its disposal any software technology that can determine the veracity of vaccination credentials when they're produced at the Grand Islands International Airport, to make them sure that these people have in fact been vaccinated in their respective jurisdictions?
Yeah. What we have to do, Barry, at the moment, every country has its own credentials, and we are hoping that the WHO or other regional bodies will come up with one that is universally acceptable. But what we have to do, and that's one of the reasons why we're not opening up tomorrow or next week with these protocols, what we have to do is to ensure that we know what are the acceptable protocols from, or what is the standard, I should say, that has been used for vaccination from the particular countries that where persons visit us from. Secondly, we have to also continue to recognize that this is a moving thing, and as Minister of Health will tell you, that the discussions as to the type of proof that is necessary internationally has still to be completed. So this may change going forward, but for the moment, what is the US standard that is used, what is used in the UK, what is used elsewhere. Let me also say that in doing this reopening, the protocols that you will see will also make the point that we will keep managing on a very close basis entries for persons who come from countries that are high risk, medium risk, and low risk. And to the extent that persons are coming out of a country within the last 21 days that is high risk, then we will require a different protocol for them than for other persons. And the protocol makes that absolutely clear.
The second question, Prime Minister. Sorry, I thought we were allowed 2 questions each. Just a quick second question. It's now been almost 3 years that we've been without a CEO at the BTMI, and now the acting CEO has gone on to a different opportunity. Can you tell us, at a time when our tourism industry has been decimated by COVID and is in a particularly sensitive place, how soon can we expect that the BTMI would have another CEO in place to direct the corporation?
Okay, first of all, I know you could count, Barry, so it's not almost 3 years. That's the first thing. I think that you remember that William, Billy Griffith was there up until about 14 months ago, 15 months ago, maybe.
I think it's almost 2 years, sorry, Prime Minister.
Well, but it certainly wasn't 3. But secondly, that position will be filled. Obviously, COVID literally put a pause on the search for a CEO over the course of 2020. We had conversations with persons, and it was felt generally that it made no sense proceeding because there was too much uncertainty globally, and anybody who is of any serious worth and credibility may not decide that they want to apply at this point in time. That now being behind us, particularly with the vaccinations of the last 3 months, and a perspective that sees some level of travel and visiting being part of our future again, we took a decision actually a couple of weeks ago that we would want to ensure that we do a headhunt to get the best possible person. And I want to make this point to the country. Whenever we have gone for the best, we have always succeeded. And this country depends too much on tourism for us not to go for it. We wish Ms. Griffith all the very best. In fact, she has done yeoman service for the Barbados Tourism Marketing Inc., and she herself was only acting as CEO in the last few months. Ms. Roach, sorry. And of course, before her was Mr. Chase, so that they were rotating within the organization persons, giving them an opportunity while we waited to do the search that we now have to do. So I'm confident and comfortable that once that search is done, and not just locally, but globally, that Barbados must get the best person for the job, and that we will continue to be ready to open back up a renewed and a reinvigorated, or as the Minister says all the time, a reimagined tourism product that is premised first and foremost on hospitality and not just substantive buzzwords. And I believe that if we can do that, I had the opportunity to work with a lot of the members of the BTMI in the early part of January and February, when of course the country was going through the difficulties. And I must tell you that I was completely impressed with their passion, and that our position is now that we need to continue to recognize that where we have to boost our capacity, we do so, and where we have to bring in training, we do so, and where we need to have a further global reach, we will do so. But at this point in time, it is of a concern, but I know you would agree with me, Barry. How many tourists came in last year?
10,000.
That's the point. Okay.
Madam Prime Minister, bearing in mind about St. Vincent itself, you mentioned that Royal Caribbean and Carnival are stepping to the fore. What exactly is Barbados doing with the challenges we already have? What are the plans towards not hospitalizing, but in other words, storing the people that may have to come over based on the fact that St. Lucia is already making plans
I
to
think
receive evacuees?
I think you mean, Ian, the word accommodated.
Word, I know.
It's too early, Ian. Rest assured that Barbados will remain engaged. I think that you've seen that where difficult times occur, we are not the kind of people to run from a difficult situation. We stand up and we are counted. At this stage, it is still too early to assess. As you know, the mere fact that we've already been cooperating with them, and helping them procure the ships and helping them put other arrangements in place and working with our regional institutions. And it's at times like this that we really recognize the value of regional institutions like SEDIMA, like the RSS with the pandemic, like CARFA. Without these entities, where would we be as a region? Because our countries just simply don't have the individual capacity to do a lot of the things that need to be done. So suffice it to say that I know that the reason why they're asking the cruise ships to come is to be able to facilitate the accommodation of persons who have to be evacuated. Until we know exactly what's happening with the volcano, it really is too early to speculate. But suffice it to say, we are guided by the right principles and we're guided by the right motivation, and we are brothers and sisters in the Caribbean.
Hi, good evening. Randy Bennett from Barbados today. I have a question for the Minister of Health. I know the ministry was concerned that while there were fewer people being detected with COVID, there was also an issue as relates to the number of testing. And the ministry had wanted to ramp up that testing. However, within the last week or so, we've had 500 tests, 200 tests. The testing has not been up to the stage where we had in January and February, we were testing 1,500 and 2,000 people per day. What does the ministry plan to do to get the testing up to that level? And would it be safe to say that at this point in time, although the positivity rate has decreased, could that still be as a result of fewer tests being conducted?
Thank you for your question. Let me say that, on the contrary, the evidence suggests strongly that if we were able to get more people tested, maybe 1,000 each day, that the positivity rate, in fact, is likely to be lower. And I say that because the tests that we've been doing for the last several weeks initially really had to do with contact tracing. So we were actually testing people who we knew could have been positive. So the positivity rate within that context would obviously have been higher. We did start, and we continue with our community program, and we've been traversing several communities on island and doing some random testing. But I can say to you that the results for the most part have been negative, which in a sense is a good sign. And I mean random testing in several communities, several parishes, so that we have been trying to encourage people to come forward to be tested. And actually the media can help us in this regard by trying to sensitize Barbadians about the need for testing. And even if there are some of your colleagues who would like to come to be tested, we will certainly facilitate that. But what has been constant, even though the numbers have been up and down, sometimes a bit lower, I would agree. We've been able sometimes to get them up to 600, 700. But what has been constant is the positivity rate. And that continues, and for several weeks, I mean for like over 30 days, the positivity rate has been below 5%. So I think all of the figures there clearly indicate that we are doing the right things, but of course we would welcome some more people who would volunteer to be tested, and we are ready to do so.
Colonel Bostic, I was just wondering how successful is government towards getting a local contact tracing app that could be publicly used?
We have
You want me to repeat the question again?
no,
Okay.
I'm with you. I'm with you. We have some local apps that we've been utilizing, but to be honest with you, even with apps and with technology, and they do help, but it cannot replace having people on the ground to do the contact tracing, and that is something that we do very well. We've been doing very well, and that is what we're doing at this point in time. But we have technology along with the persons on the ground to be able to help us to do it, and I think that we have the right mix at this point in time.
Minister Bostic, from CDC. Based on what the Prime Minister said, it looks as though we're going to have a higher capacity for testing if we are successful in getting a lot more tourists to come using the new vaccine approach that we were planning to use. But one of the problems that we had in December were actually related to results. Is that side of things being taken care of? Because even if you have all of those tests being done, then the results, if we have a large influx of visitors, which we would probably like, do we have that capacity to generate those results in a fast enough time for people?
The answer is yes. Obviously, we would have said over the last several months that there were some challenges with reagents and so forth. And we also had some challenges in terms of being able to get the results out. We've put a lot of things in place. We've changed a lot of things that we've been doing, and we are satisfied that we are on the right track. But I will tell you this, and I issued this to my team only last week, that from next week, and especially now that the numbers are down, we are going to be preparing for anything else that may come later on. And so we are going through every single step, every single process within our operations to make sure that we are on top of things even before anything else comes our way that may come our way. And this is the one way of giving the assurance to the team and to the country that we are ready.
Minister, twice this week we've had a situation where the positive test, the new infections were all females. Have you received any information from public health officials where they've extrapolated this information? Why are we seeing an inordinate number of females testing positive for COVID-19 way more than males?
No, my answer is no. I have not received anything from public health in that regard. But to be honest with you, it really does not matter to me. As long as we have positive cases, then that is the issue, whether they're male or female. But there's nothing, no magic to it. That is just the way it is at this particular point in time. And there's no answer for that.
Anything really on the bracelets, tracking bracelets lately? Are those still in use right now? And are you going to look to ramp those up again in terms of bringing in more, looking ahead again to that, to possibly getting more tourists in the island?
Yes, they're very much in use, and they've been working quite well, to be honest with you. We have a team, a dedicated team who check on persons with the bracelets, and if there are any issues at all, we have a response team, and the team has been responding. But we've not had any incident that would suggest any malice or anything of the sort, and we are quite happy so far with the way they are working. The ramping up, we actually had placed a large order, but we could not get everything at once, so they've been coming in batches. So yes, the answer is that we're going to get to where we want to get.
And unfortunately, given the fact that the Prime Minister does have another meeting to attend, I know I promised 2 questions each, but we do have to end at this time. Let me thank Prime Minister, the Honorable Mia Amor Mottley, for joining us, as well as the Minister of Health and Wellness, Lieutenant Colonel the Honorable Jeffrey Bostic, as well as the Attorney General and the Minister of Legal Affairs, the Honorable Dale Marshall, members of the media, and you for joining us. Good evening.